you're finding very young people are now being diagnosed with cancers, diabetes, hypertension, thyroid issues, weight gain that is refusing to go away no matter how much you're trying to eat properly, exercise, amongst other things. The role of functional medicine is quite high because it digs deeper as to identifying why exactly do you have that chronic disease other than genetics, because genetics is a very small percentage. The fact that it gets to the root cause and then now addresses that root cause is what makes such an important aspect, bringing it into the chronic disease world. Those root causes are things that are likely within your environment, and they are things that are bound for you as a person to change by yourself. Sometimes we are always like, the government should do this, the government should do that, the government should do this, but you at where you're seated at, what are you doing about it? Are you seated there saying, I will be eating bread the whole week? Or you're just eating processed foods constantly and then say, but that is a lifestyle disease I'm developing. I've actually seen people say that they're developing diabetes. I need to have a midlife crisis condition, like a yes. So it's like they feel they've I don't even to say actualized or something, I don't know what the word is, because they feel like I have diabetes, I have hypertension, I have this, I have that. So please, let's take care of ourselves first. Number one is you as an individual. By the time you're going to say, I need to pay for insurance, I need to do this, I need to do that, work on yourself first. By the time you're saying you need to go and see a psychologist, what are you doing about it? Which space are you in that you need to get out of so that you can be able to, before you even go see that psychologist? Because you might go pay $1 and, maybe you didn't even need that psychologist. I say functional medicine is very affordable because we are looking at things that surround you or affect you more. So prevention is always better than cure, anytime. You don't want to be in a life of where you're walking in and out of hospital every single day. You're mentioning, yeah, my blood pressure, my diabetes, my eczema, my asthma, my chest, my. Wewe unataka imagine umekaa tu mahali ukumbukangi hata ndio kuuliza when was the last time you were in a hospital, but ukumbuki. You have to actually think about it to be like, so your quality of life and your well-being is what we are after. Because the main aim, all we want as doctors is for the best patient outcomes, right? And to lower all these prevalences and chronic disease outcomes. And the best part would be, you'd find the burden, the prevalence, the incidences would go down, and our longevity would be, yes. When you're in your 80s, you hear you have diabetes, do you have this, I'm going to my doctor, I see so and so. It doesn't have to be. Because when you make those changes, now it becomes part of your lifestyle. Right. When you change them in your younger years, they are now things you end up practicing in your consecutive. Yeah. Genetics does contribute to disease. Ama hiyo kusema iko kwa damu, iko kwa genes, iko kwetu. But with recent research, it shows that not all of us who are genetically predisposed to a condition will actually develop that condition. Sometimes a genetic predisposition remains a genetic predisposition. But if your life is of quality, you're healthy, you exercise, you sunbask, your mental space is okay, you're sleeping well, your relationships are doing fine, you find you don't trigger conditions X. Flip side happens when we are sedentary, we are always in the office, hatuoti jua, we're not sleeping well, you had a divorce, it stressed you out so badly, and you've not managed to get out of that space. You lost a loved one, you didn't manage to get out of that space. Those factors end up being causative trigger factors to now, if you are genetically predisposed to something, to it developing. I have read and gone through quite a bit of data, because when you practice integrative medicine, you actually go beyond the box of thinking that it's just diet and lifestyle. Some young people I get, they lost a parent at a young age. When you sit with them, you change their diet, you change their lifestyle, you notice the pressure is still misbehaving. And then you sit and further ask, okay, you're mentioning the first time that you fainted was day X. What happened? What was different? So when you dig deeper, you find they tell you, Mimi, after my parent died, I didn't want that issue. Like, I just moved on and went. There's a grieving process, there's something you go through, right? So you find such a stress factor was what was psychologically triggering now a hypertension issue. You can be genetically predisposed to a condition and not end up developing that condition. And you may not be genetically predisposed to anything. Maybe in your family, no one has ever had cancer, nothing like that, but you're the first person to develop such a thing. So that can also happen. And remember, we are also now looking into other factors, as I mentioned: diet, lifestyle, environmental exposure, heavy metal exposure, things like mercury, cadmium, some types of arsenic, amongst some pesticides, herbicides, the chemical exposure. What are we eating, putting into our mouth? What are we putting on our bodies? There's so many other factors that have now come in that have been linked to some of these chronic diseases. And you can be exposed to those things through different ways. You can be exposed through, it could be water, and it could be the type of soil. Now, when you're discussing the type of soil, it means that it's a thing that moves beyond the Ministry of Health or just health. It goes into agriculture, things like climate change, which goes to say that when we're handling health, we need to handle it from a multi-stakeholder kind of thing. So when we look at you at K's Wellness Center, we do our very best to be able to assess your body if you have any of those heavy metals, any chemicals, exposure to endocrine disruptors, which are things that actually affect how your hormones are behaving. Because you know what? You could actually be having a difficulty in losing weight because there's an imbalance in your hormones. So that's why you're having difficulty losing weight. But in the first place, what exactly caused that hormonal imbalance? Most of the times you find it's endocrine disruptors. Sometimes you also have vitamins and mineral deficiencies, which you can actually check. So when we get to the root cause and identify factor X is what has actually caused the problem, then we deal with that factor which we've identified so that we can be able to improve your quality of life and your well-being. A holistic approach to your health is the best bet you have, because we're not just focusing on your head. Because you had a headache, we're not just focusing on your head. Because you had a tummy ache, we're not just focusing on your head, on your tummy. And remember, when we're looking at health, let's also now put into consideration our children, because our children are the next and the future generation. So if they learn some of these things from us, they are bound to do things different. Number two is, if you're able to, please get insurance, whether you're sick or not. Don't decide like I'm getting health insurance because now I was pricked. They found I have diabetes. What was those sharp people say now is when you're going back to figure out if you need health insurance or you've been admitted. And then at that point is when you're like, you go to the finance and they start telling you, today's bill is just 50K. Tomorrow is another. And you see the costs, it matters. It could be you're admitted in the ward. It could be an ICU, a HDU admission. That is now on a whole different scale. You would find a day clocks like 10, depending on where you're admitted. So get that insurance. And let us stop saying we are getting the insurance at the tail end. Get it before, because it can be used for you as a person, your children. There are people you can put inside. When you take insurance, you can add in your family, your people inside that insurance. And we are using it as a pool. Even the SHA thing is money being collected to be used as a pool. I learned something from a close relative of mine. They said, stop feeling like because you're paying for SHA, because you never use it, so why am I paying for it? There's that person somewhere who is not even able, because maybe you're able to pay for the government insurance and you're able to pay for private insurance. Okay. And there's that person who can only afford to pay for the government insurance. Mm-hmm. So if you put your money into that pool, because that's how insurance works. There's a pooled center of money, then they pick a few coins for you who deserves it, and then they use it on person X. So pay for it. If you can be able, please just pay for it. As a guy who knows only how hard it can be to live with a chronic disease and the complications that come with it, I purpose to ensure we look at our patients from a holistic perspective. So when we get to the root cause and identify factor X is what has actually caused the problem, then we deal with that factor which we've identified so that we can be able to improve your quality of life and your well-being. Because it's better to prevent and live than to actually get it and then you're now trying to prevent the complications or reduce your eating complications and things like that. So I urge all of us, prevention is better than cure. So come, let's check you before you become complicated.